Hi, my name is Jennifer, and the name of my video is called The Beauty of a Lethal Toxin, Clostridium botulinum. So let's talk about it. These are gram-positive, rod-shaped, endospore-forming bacterium. They have the ability to sporulate going dormant when conditions are not favorable. And then when the environment is optimal for growth and reproduction, they are able to germinate into their former state. These endospores are normally not pathogenic, yet when they go through germination, they're able to produce a lethal toxin. They are classified as anaerobic due to the ability to reproduce under low oxygen or no oxygen conditions. In discovering the nomenclature of C. botulinum, I found that the domain is bacteria, the phylum is Bacillata, the class is Clostridia, the order is Eubacterialis, the family is Clostridiaceae, and the genus is Clostridium. This bacterium got its name from a Greek word meaning spindle due to its physical traits when observed under a microscope. The word botulinum comes from the Latin word meaning sausage. This was due to poisoned sausages being the cause of severe symptoms of food poisoning disease. Botulus is the Latin word for sausage, not because it looks like sausage, but because it was traced back to when there was an infection caused by sausage, and that's how botulinum or botulism got its name. The disease that this bacterium causes is called botulism. This is a disease that attacks the nerve communication to the muscular system. It can lead to paralysis, and it is usually symmetric descending paralysis, meaning that it happens on both sides of the body and it starts from the head and goes down to the toes. There are three different types of botulism. There is foodborne botulism, infant botulism, as well as wound botulism. Although these three types of botulism are contracted different ways, they do have common signs and symptoms, some of which are muscle paralysis, difficulty breathing, double or blurry vision, and slurred speech. Obviously, there are additional signs to look out for depending on how the disease is contracted. Besides those symptoms, foodborne botulism can include stomach pain, nausea, vomiting, and diarrhea. In infant botulism, signs may be constipation, difficulty focusing, difficulty breathing, unusual behavior, late reaction to light, and one of the most common ways that infants can contract this is by ingestion of some foods. That is, this microbe can be contaminated due to processing of honey and inhalation of endospores carried through soil and dust. I remember hearing for a long time that you're not supposed to give honey to babies under 1 year old. The reason for this was that they do carry endospores that sometimes can germinate inside of the body, and the babies do not have the immune system that is strong enough to fight off these endospores. As adults, we do have the ability to do that, just in case. That is why they always say that. Botulism is a disease that is Non-communicable. This means that it is not transmitted from person to person. This is great news because this means that it is not contagious. It is usually contracted through ingestion, inhalation, or even through an open wound, including the injection site in regards to drug users. Botulism is a sporadic disease, meaning that it occurs irregularly. This is um, this is better. This means better control of the disease since it is not spread easily like other diseases. In the U.S., there is about 110 cases of botulism that are reported annually. 25% of these cases are foodborne botulism, 70% are infant botulism, and 30 to 40% are wound botulism. Although it is a rare disease, it is a very dangerous one. Recovery can be as little as 2 weeks and can take up to years depending on the potency of the toxin and the severity of the disease. Botulinum neurotoxins block the release of acetylcholine required for communication between neuromuscular junctions. Due to this, following tests can be done to diagnose botulism, that being neurological scans, spinal fluid examination, as well as function tests that check out the function of the nerve and muscular systems. Antitoxins are used for treatment when it comes to this disease. They help neutralize these harmful toxins, yet they do not reverse the damage that is already caused, but they can help neutralize them so that further destruction is avoided. The toxins affect the respiratory system sometimes, so in order for the patient to have that help in breathing and recover properly, a ventilator may be used. Rarely is surgery used in order to remove the source of bacteria, and then antibiotics are also used to help complete the treatment of this disease. The case study that I looked into is called Management of Unilateral Idiopathic Masseter Muscle Hypertrophy with Botulinum Toxin Type A. This was a case study that was published in 2020 in which a patient was injected with the toxin A in order to help a protrusion that she had on her cheek. It was nothing that was hurting her, it was just aesthetically displeasing for her. The hypothesis of this clinical trial, of this study, was that if she was injected with this muscle relaxer, it would help stop the growth of this protrusion and therefore help her regain symmetrical jawline. The reason for this case study's amazement comes from the fact that we are now able to use these toxins to help cure or alter instead of only seeing them as deadly or disease causing. Research data suggested that the injection of the toxin would be a conservative approach as well as be an alternative to surgery, in which would be a far more invasive. In conclusion of the case study, once the injection took place, the symptoms were apparent about 4 weeks post-operation. In total, they injected the patient with five different shots over the masseter muscle, in which resulted in satisfactory facial symmetry. I was also able to look into a peer review article called Botulinum Toxin A Products Not Interchangeable, a Review of Evidence. The reason why this one intrigued me is because it goes into the different ways that these injections are processed, meaning that injectable biological medications are marketed to produce specific results. These toxins are handled a specific way in order to target specific tissues, and this process is precisely calculated. And the doses are crucial for patient safety due to it being a toxin. Treatment of overreactive muscle conditions or use of Botox injections requires specific fundamental properties, even if derived from the same bacteria. excipients are added to control toxins' potency and for its ability to have multiple functions. One way of producing the medication is not the fit for all treatments. It is not interchangeable. In order to prevent medication error, the FDA determined that there were 3 products that were widely produced, and each should have their own non-proprietary name. There are onobotulinum toxin A, abobotulinum toxin A, and inobotulinum toxin A. This article goes into the differences in which this toxin must be processed in order to produce specific results. It also talks about the site of injection and how it is important when injecting the medication due to not wanting to target the wrong muscles, causing paralysis. In order to provide the best results and keep patients safe, these labels are on the products and are derived, even though they're all derived from C. botulinum, they are all asked to, the clinicians are asked to follow manufacturer guidance in order for safety. These safety parameters are required in order to show appropriate respect and appreciation to the nature of this bacterium, which is a very lethal one. Consistency and efficacy are required to produce satisfaction for clinicians as well as their trusting patients. The fascination of this bacterium to produce these lethal toxins and how developing sciences can use those same toxins to cure or alter human conditions make Clostridium botulinum worth mentioning. Thank you for listening, and I hope that your curiosity has been sparked in knowing more about this deadly toxin-producing bacterium that is also used for good. Bye.